Mr. Murphy.
Thank you, Mr. Chairman. A few weeks ago, when he testified before this committee, the chairman of MedPAC had to say this, quote, "The healthcare delivery system we see today is not a true system. Care coordination is rare, specialist care is favored over primary care, quality care is often poor, and costs are high and increasing at an unsustainable rate." This is an unacceptable indictment of our healthcare system. But we have even more reasons for systemic change when we look at what's happening at home. In Connecticut, a new report shows that between now and the end of next year, 48,000 more people are going to lose their health care insurance. Why? Well, in part because just 2 weeks ago, our biggest insurer that covers 50% of people in Connecticut announced that it was going to increase rates on individuals by 32% this year. So it's time for all the people in this Congress who talk a lot about reducing costs to actually walk the walk and support the things in this bill they're going to get at cost. That's prevention, the public option, and delivery system reforms. Yesterday, CBO laid it out pretty clear for us. The public option is going to save almost $100 billion in costs to our system. Why? Because by injecting competition into the insurance system, something that nobody here should be scared of, we can give consumers more choices and lower costs. That's a real number from CBO. But equally important are what we have to do on the payment delivery system. And here we can be much more aggressive. We have a system now that rewards volume, and it puts providers in an unsustainable position. They have to gin up a ton of business to be able to be paid what they're worth, and they try to keep quality at the same time. We can do a lot more in this bill to take ideas like accountable care organizations, medical homes, and bundling of payments to try to correct that situation and let the federal government get out of the way of medical care and allow physicians to focus on what they want to do, which is be paid for quality. Mr. Chairman, 2 weeks ago, a man came to one of Congress on a Corner events that I hold every now and again at grocery stores, and he told me this story. A version of this can be repeated 1,000,000 times around this country. He's worked his whole life in construction. He's got 3 kids, but he's out of work right now, a victim of this paralyzing recession. He's desperately seeking a new job, but he wakes up every day in debilitating fear. Why? Because he's got diabetes, and he can't afford right now to buy his medication. So he is waiting for the day that he ends up in the hospital and the medical bills mount so that his family loses their home and becomes one of the 50% of bankruptcies in this country that can be attributed to medical costs. That guy came to me with a question. He said, what is this whole health care debate going to do for me and my family? Well, Mr. Chairman, the bill before us, which gets 97% of Americans covered, lowers the cost of health care insurance for everybody. Well, it can be a better bill when we're done with it over the next few days, but I'm pretty confident it provides the start of a pretty good answer. And I yield back.
Thank you, Mr. Murphy.